In late March, Incision UK and Lifebox GSA hosted a 2-day online interdisciplinary forum. With a range of talks on different fields of global health and surgery, alongside a hackathon, this forum provided students with an opportunity to further their global health knowledge. So, what did we learn about global surgery? Day 1 began with Dr. Rahul Jindal, a transplant surgeon and commissioner in the Office of Human Rights, Maryland, talking on ethics and law. Some key topics which were discussed included the various ethical frameworks relevant to global health, such as Crass and Stapleton, the ethical considerations we should be making during an elective, and discussing about what is ethical for a student to do when overseas. And finally, the ethical dilemma of resource allocation using the kidney transplant program in Ghana as an example. Following Dr. Jindal was Dr. Cheelan Reddy, a global surgery fellow and research associate at Harvard Public Health, who introduced us to global health politics and policy making. The talk began with Dr. Reddy familiarizing us with the relevant terminology and explaining the theories on how power is distributed in society. Following this, we discussed how political values have influenced global health using 3 different eras. This was then related to the political determinants of surgical care, as Dr. Reddy pointed out how history has affected surgical access and that colonized countries have less access. The talk concluded with an interesting breakdown on the logistics behind creating a surgical package. Dr. Reddy demonstrated that there are many different considerations that have to be made, including determining who is eligible for healthcare and the level of healthcare in which these people receive. Our final speaker of the day was Dr. Kokila Laku, a consultant pediatric surgeon and the president of the Global Initiative for Children's Surgery, whose talk focused on surgery and academia. Dr. Laku began by providing some background on the relationship between children and safe surgical access, and informed us that over 2 billion children lack access to surgery, and that 85% of children will need surgery before their 18th birthday. We were then introduced to the Global Initiative for Children's Surgery and how it is addressing these issues. Next, the Global Children's Non-Communicable Diseases was presented alongside a discussion on its various research projects, including COVID-19 NDS. Dr. Laku also informed us of a short postgraduate global surgery course available at Oxford University's Department for Continuing Education. 6 teams of multidisciplinary students joined us on day 2 for our highly anticipated hackathon. Teams were presented with one of 3 challenges. Challenge 1 was what strategies can improve uptake and fidelity of safe surgical checklist use. Challenge 2 was what would you do to bridge the education and awareness gap in precision medicine. And our final challenge was what would you do to help achieve better follow-up for patients who have returned to homes far away. Our winning team was Team 1, who emerged victorious with an innovative solution to our first challenge. After the hackathon, we were joined by Dr. James Chandler. In his talk, Dr. Chandler demonstrated how engineering, computer science, and innovation can be used to address global health issues, using robotics for low-cost endoscopy as an example. This example began with an explanation of the burden and challenges of gastroesophageal cancer. We were then introduced to 2 pieces of equipment that might solve this issue. These were the beloscope and the hydrojack. Dr. Chandler then discussed some of the various future prospects for gastroesophageal cancer, such as AI integration. The session ended with a reflection on engineering's role in global health and the key considerations that must be made. Hacking Global Surgery concluded with Ms. Chris Torgerson, the global CEO at Lifebox Foundation and a board member of the Drugs for Neglected Diseases Initiative, discussing advocacy in global health. Ms. Torgerson provided insight into numerous areas of advocacy, including the need for advocacy alongside some of its requirements such as evidence, stamina, and defined goals and targets, the current state of advocacy, and areas like policy follow-up and leadership which require improvement. Ms. Torgerson then finished her talk by discussing the future of advocacy and where we as students can fit into this. Thanks for watching this video. What was your favourite part of Hacking Global Surgery? For more global health content, make sure to check out Incision UK's platforms such as our website and our social media.